that I have loved. Most especially, though, I found a second family. And the staff in the Office of Emergency Medical Services, most of which have been with us for a very long time. My Maria, who's been my secretary and the person who kept me young for the last 20 years, and especially to Nancy Kelly Goodstein, who we have worked together for 28 years. And I hope to turn the reins and the chair, and not the crown, because I didn't get that, but the crown over to Nancy as I leave tomorrow. They are the most dedicated and committed group of individuals. You talk about state workers. They are not state workers. They are people who came from EMS just like you. They love their jobs, and they do their jobs 24 hours a day. It doesn't matter what time of day or night they do their jobs. So any successes that I've received credit for have not really been my successes. They have been our successes, and I want them all to know that. So I would like them to rise tonight and be recognized with my deepest thank you. And the greatest, I've told people that this is sort of like jumping off a cliff, but the greatest thing I'm going to miss is the people and these folks that I have worked so closely with. Can you please stand for me? Thank you. Now, I am going to have to get even, though, at some point for this embarrassment all evening in the chair, and I plan to try to take the chair home. Oh, okay. My first Director's Award this evening, the recipient is the epitome of what teamwork is all about. Although his job is one that supports the New Jersey links and IT issues, over the past few years he has become an integral part of the Office of EMS. He has been an essential part of the implementation of the new EMS provider licensing system, working with OEMS staff to meet the challenges of introducing a new interactive system to the agencies. He has also worked tirelessly behind the scenes for the past few years to ensure that this EMS conference runs smoothly, except for the other morning when my slides didn't make it up in total for my speech. Even at this moment, he's working passionately to provide the critical uplink for this webcasting of the awards dinner. So tonight, it's my honor before I go to bring him from behind the curtain into the spotlight. Please join me in honoring Bill Capella. Next, I had planned to honor this medical director at the 2012 November 3rd Awards Dinner last year, but we all know how well that turned out with Superstorm Sandy. As the founding father of our GEMSTAR program in 1986, he helped create a program cited as a model for the delivery of air medical services in the nation. Since that time, more than 30,000 patients have benefited from his efforts. He served as the chairman of the GEMSTAR Advisory Committee and served as an MICU medical director for Virtua for more than 30 years. He has been both an innovator and a champion of quality patient care. After first announcing his retirement in 2012, they couldn't live without him, so he came back from retirement. It is my pleasure to recognize Dr. Joseph Hummel. 。 . 。  . 。 . . . . . . . . . . . . . . . . . . . . 。 . . . . . . . . . . . 。 . . . . 。 . . 。 . . 。 . . . . . 。 . Here's another recipient that I had promised to honor at the November 2012 dinner as well. Our next recipient has been an emergency physician since 1982 and has made contributions to EMS at the local, state, and national levels. Instrumental in keeping the focus on quality care for every child through pediatric education and equipment, the emergency department education through simulation program, which he helped create, that has been recognized for its success. He has participated in developing the minimum equipment, supplies, and medication lists for both pre-hospital care and emergency department use, as well as the emergency information form for children with special health care needs. He is an inaugural board member of the Children Can Shape the Future, a philanthropic organization that promotes community building programs in the local Camden and Philadelphia areas. He is a tireless advocate for EMS, a quality health care provider to his patients, and a resource to our office. As you heard earlier, he is the chairman of our EMS for Children Advisory Committee. In 2010, he was awarded the State EMS for Children Policy Leader of Distinction Award by the Federal EMS for Children program, and in 2012, he was selected by the American College of Emergency Physicians as the Outstanding Speaker of the Year. It is with great pleasure that I present this Director's Award to Dr. Al Sacchetti. Now, for these next couple of awards, I'd like Ken Christensen, our state EMS coordinator, and Terry Clancy, who was, during Superstorm Sandy, our EMS task force coordinator, to come up here and join me, please. They were the leaders in coordinating our Superstorm Sandy efforts, and I need them to help me recognize these next couple of groups. The first group I would like to recognize is the New Jersey EMS Task Force. While the EMS Task Force is an entity coordinated by DOH, it is made up of more than 200 dedicated individuals statewide. We have 3 regional planners, including Debbie Bell, Henry Corticans, and our newest planner, Neil Maida. Henry and Debbie's efforts during Sandy made up the backbone of our EMS response. They exemplify what I meant earlier when I said our greatest resource is our people. Will all our task force members please stand and be recognized by the group? Thank you for everything you do, but there is no rest for you, as you need to start getting ready for Super Bowl in February of 2014. The next group of individuals I have recognized before, and they are the county EMS coordinators. Their tireless efforts allowed us to obtain the necessary resources to respond effectively both during Superstorm Sandy and in the days afterward. Many of these individuals were on 16 consecutive days of conference calls with me every single day. And I also know that many of them and many of our task force members were personally impacted by the storm. Using both our in-state resources and our out-of-state resources, we were able to provide a well-coordinated 911 response statewide for our residents during one of the worst disasters we have ever faced in New Jersey. I'd like to call up now Debbie Bell, Henry Corticans, and all of the county EMS coordinators to come forward and be recognized and receive a small gift from us as a token of appreciation for your service. Thank you.
First time we ever lined up like that without there being one-way window in front of us.
Well, I have more to give.
More what?
I have more awards.
No. I'll do those awards.
What, the outstanding EMS calls?
Yep.
Oh, okay.
And the lifetime prize.
Oh, okay.
Yep. Oh, yeah. All right, ladies and gentlemen, we are approaching the finish line. And we're on schedule. You're doing real well. Great, great crowd. Appreciate it. The outstanding EMS call. Now, these next three awards, in my mind, are the premier awards here in the state of New Jersey every year. They truly distinguish outstanding service in various formats. In the Outstanding EMS Awards category, there are two winners this year. One, the first award has to do with scene surveillance. The second one has to do with Sandy. Let me go with the first award for scene surveillance. What you're trained in your EMT class and what is constantly driven into your mind, scene safety and awareness. First call would like to recognize involves two EMTs near the end of their shift when they were dispatched to Penn Station in Newark for a patient complaining of chest pain and a headache. The patient was accompanied by a woman and a young child. During their assessment and transport to a local hospital, both EMTs sensed that something was not right with this situation. It did not pass their sniff test. The patient seemed nervous and uneasy and did not want anybody to know where he was being treated. While at the emergency room, additional information for the patient chart was collected and discrepancies in the story between the women and child were noted. The EMTs notified hospital security of their suspicions. An investigation was begun, and it was concluded that that child